The Harris Health HealthyConnect program is a remote monitoring blood pressure program where we assist the patient in managing their blood pressure. From they're able to take their blood pressure at home, we're able to help them monitor and manage.
We do that by providing them with education around hypertension, encouraging medication adherence, but also working with them and their provider to make sure that their medication plan is one that they can follow and be successful.
I learned about HealthyConnect program through my clinical pharmacist, and he told me a little bit about it and that they would be able to keep track daily of my progress from home. I would hate to have to go into the clinic every day to take my blood pressure. And he said, well, I will give all your information to the nurse that's handling that, and she will contact you. And she contacted me within that week, and I was ready to go.
The doctor actually puts a referral in when they find that the patient meets criteria. We will call the patient, offer their program, see if they're interested. Once they are, we enroll them. Once they report the blood pressure, it goes into their chart where the doctor and the patient care coordinator can also view them. That's how we make our plan for the patient to succeed in our program.
So one of the best things about the HealthyConnect program is that it allows us to keep track of blood pressures in the comfort of your own home, where the measurements are actually more reliable. It also lets us adjust your medications and check in on your progress without having to bring you in for a full clinic appointment, which lets us support you in getting better blood pressure control at home.
My patient, Stephanie, was a beautiful woman. She didn't want anybody to have to take care of her. She wanted to be able to manage her own life. So we started with hypertension education. She was very excited to learn.
When she went through all of the steps, what we needed to do, how we needed to do it, then she had us to actually do it there in the office with her in the classroom. She was a liaison to my doctor, which made a whole different two different people that know exactly what should be happening, getting together and making a decision of the dosage for me. And then pretty soon it started working directly the way she said it would.
Overall, our patients that graduate experience a pretty significant drop in their blood pressure, which is really adding life to the years that they have with us in terms of reducing their risk from uncontrolled hypertension.
It's really rewarding to see patients get their blood pressure under control. One of my favorite things is when Ms. Lopez sends me a message that says the patient has graduated from the HealthyConnect program because that means the patient has gotten their blood pressure to goal.
I am most proud of the fact that we are providing care in a way that is accessible to patients, that doesn't require them to have to miss work or find childcare. It also gives us an opportunity to connect with them in different ways and leverage our MyChart platform, which we spend a lot of time, not only educating the patients on it, but letting it be a tool for helping them to manage their blood pressure, whether that's communicating with their doctor or connecting with pharmacy to get their meds delivered to home or select refills. I think ultimately it is looking at healthcare in a different lens and being able to really tailor it to meet the needs of the patient. And I think we've been able to do that with HealthyConnect.
I would recommend it to anyone that is having problems with their high blood pressure. Where there is doubt, faith. Where there is despair, hope. Where there is darkness, light. Where there is sadness, joy.